Dr. Martinez is here talking all things ADHD. And so we wanted to know, since we talked about how it affects kids, how it affects adults, how it affects teenagers, how it affects women a little bit differently, what can we do to help treat it?
So I'm going to start with, we're just going to do this developmentally. So for kids, again, as I mentioned, I think school is often, or other structured activities are probably some of the places where children do get noticed. So I think that if a teacher is noticing a child has problems, they should and can speak to the parents or guardians about that. And then it's up to the guardians to make a decision about what they want to do about it. First step would be that the youth sees their, it could even be starting out with the pediatrician, whoever their primary care provider is, and they just mention it. The parents or guardians mention it, and there are rating scales that most, I would say, even pediatrician offices have that they could give to the parents to have a parent and teacher fill out. So that's the first thing I would say, is getting diagnosis, getting some objective ratings of how the youth is doing. And then if a decision is made and it seems like that's the correct diagnosis, then the first step does not need to be medication. Schools, if a child has a diagnosis, the schools are obligated to provide a variety of things depending on the school district, but it is actually part of federal law that they actually can work with the parents and provide like an in-school plan, or if it's more like an individual educational plan, so an IEP. Parents need to ask for it. It's actually protected by the Americans for Disabilities Act. And I always hate to say the word disability when we're talking about a kid, but that's the act that protects it. So a parent is allowed to ask for help. That can include a stand-up desk, allowing people to have fidgets, sometimes even chewing gum, obviously depending on the school. So sometimes just something to distract them, allowing them to doodle on their paper, having more time to take tests. And so sometimes it's just behavioral things, allowing them to have a recess after every 20 minutes or half an hour where they get to run around. So those are kind of the first steps. So a lot of parents obviously worry they don't want to go right to medication.
Sure,
so that's not the only treatment.
Yeah. So let's take a couple of questions. So I think you answered this, but I want to be sure. Is it true that educators cannot mention to parents that their child may need to have an assessment to determine if their child has ADHD?
The educator cannot demand any kind of mental health assessment of any child, whether it's for that or anything else, but they can mention that they are noticing behaviors. And again, I think the best thing is for parents not to feel overly defensive, but just take that in as information. The parent or guardian is the person who decides what they want to do with that information. And then again, there are objective rating scales that a parent or guardian could decide to give a teacher, a coach, a chaplain, whoever they want, to help. So there's usually a parent rating scale and then another person, or you can have multiple other people, even other family members, provide a rating scale. So the first thing I would suggest is like an educator can mention that, but they cannot demand that someone get an assessment.
That's a good clarification there. This next question is, if your child is already on ADD or ADHD medication and they suggest to apply an immediate release medication, what are some possible medication names that they should be looking at?
So the first thing I'm going to suggest is that anyone who's not a medical provider should never make a suggestion about the type of medication that someone needs. If someone has a school nurse they're working with, that might be different. But if it's not a medical person, no one else has a right to make any recommendations about medication. That being said, depending on what medication they're on, if it's a stimulant, there are both extended release and immediate release stimulants in multiple families. So it kind of depends. So the methylphenidate one that probably many people are familiar with is Ritalin. There's also Focalin, and they might be on longer acting ones like Concerta, or, so there are lots of, I couldn't even list all the brand names. If it's an Adderall prescription, so there's Adderall XR, and there's a much longer acting one, which is Vyvanse, and then there are various forms of immediate release of that medication. And then some individuals choose to be on a non-stimulant, which is Strattera or atomoxetine. In that case, there's not an immediate release atomoxetine. That is a medication you have to take every day.
It's just good to know that there's that many options.
There are so many options.
If something's not working for you.
If something's not working, or maybe something wears off, or a kid's not eating, that we see that more in children than adults. So adults don't tend to have as many problems with the appetite suppressant problem, but youth often do. And it's a big problem if your kid doesn't eat all day and they only eat dinner and they're feeling faint at lunch when they're trying to have recess. That's not good. So there are lots of options. Unfortunately, it does depend on the school. If there's a school nurse or if they need an immediate release medicine, who would help the kid with that? Because in general, kids are not allowed to just carry around those kind of medicines with them.
Gotcha. Speaking of food, this person's asking, can certain diets help with hyperactivity?
So yes, I mean, I don't think that there's an ideal diet that like prevents against that. It is, brain disorder, the brain is already developed, but I would definitely say that diets like rich in like immediately processed sugar are not usually good. So I don't think that sugar causes ADHD, which I think I'm probably much older than many of the people listening, but I think that was a thought that processed sugar caused ADHD. There's no evidence that that's true. But kids who have bursts of energy from processed sugar and then that wears off, like, can experience both that initial burst of energy and then the lack of focus and everything when that wears off. So I would say that diets that in general, probably like we should all be eating healthier diets, a balance of protein, carbohydrates, not a whole lot of sugary things, which can include juice. I think sometimes parents don't think of juice as something that's bad. A little juice is okay, but juice also has a lot of sugar. It's fructose, but it's still a lot of sugar.
Okay. All right, so this next question is, does every child diagnosed with ADHD have to have medicine?
Absolutely not. So, and I would say, depending on the age of the child, the first steps would be to do other things to try to put things in place. And it very much depends on the kid. So if they're very hyperactive and impulsive, it might be, as I mentioned before, giving them a stand-up desk, giving them some extra time for recess so they can burn off some energy, allowing them to have a fidget or something else so they don't feel like they have to hold still. If it's a kid that has more problems with attention, it might be letting them sit in front of the classroom, being able to have more time on a test. So it really needs to be personalized. So there is not a one size, everyone needs to be on the same. Yeah, one size. It is not one size fit all at all.